I know that globally there is currently a lot of concern about the Delta variant, and WHO is concerned about it too. Delta is the most transmissible of the variants identified so far, has been identified in at least 85 countries, and is spreading rapidly among unvaccinated populations. As some countries ease public health and social measures, we're starting to see increases in transmission around the world. More cases means more hospitalizations, further stretching health workers and health systems, which increases the risk of death. As we have said, new variants are expected and will continue to be reported. That's what viruses do. They evolve. But we can prevent the emergence of variants by preventing transmission. It's quite simple. More transmission, more variants. Less transmission, less variants. That makes it even more urgent that we use all the tools at our disposal to prevent transmission. The tailored and consistent use of public health and social measures in combination with equitable vaccination. This is why WHO has been saying for at least a year that vaccines must be distributed equitably to protect health workers and the most vulnerable. Over the past 18 months, WHO staff all over the world have done an amazing job supporting countries to respond to COVID-19. But WHO cannot be everywhere. The problem is if countries use it as a pretext not to share or not to give doses. The reason we're really concerned and why Mike said and Bruce said what they said is it happened in the past. You know about HIV treatment and what some of the arguments were, and where some were trying to justify that, especially in low-income countries, people cannot use, HIV treatment, which is very complicated, so we cannot share it with them. I mean, that attitude has to be the thing of the past. And what I would like to assure those who are prepared to give vaccines is, we have done our homework with the World Bank, assessing countries, identifying the gaps, helping them with filling the gaps, but at the same time, they have experience of using or implementing mass campaigns for several years. So they have the experience, but we also try to work with them to see if there is any gap. So the shortage, the problem now is supply problem. Just give us the vaccines. Some people were asking me about vaccine hesitancy in Africa. And then I say, that's not the problem. There is no vaccine, so why do we even talk about vaccine hesitancy? The problem is vaccine supply. And even now, it's not the absorptive or the delivery problem that's a problem. There is no vaccine. You can't even talk about delivery or absorption capacity when there is no vaccine. So the problem is lack of access to vaccines. And that's causing a two-track pandemic. Those who have vaccines are getting better significantly, and they're opening up their society. Those who don't have vaccines are facing serious COVID situation with serious surges in cases and deaths due to COVID. That's the reality now. So let's be real. What we need is vaccines. The problem is lack of vaccines. It's not delivery, it's not problem in absorption by and large. We can have that maybe when we have more vaccines. It's lack of vaccines. It's not hesitancy, it's lack of vaccines. And the situation in many countries, in low-income countries, especially in Africa, it's very worrisome. I said it many times, and I sent a tweet, actually, I posted a tweet yesterday about the worrying trend in Africa. It's becoming so dangerous. And the difference now is between having a vaccine and not having a vaccine. The difference is between the haves and the have-nots, and which is now completely exposing the unfairness of our world, the injustice, the inequality. That's it, let's face it. And that's the problem. And we need vaccines now. That's the issue. Then let's try if absorption or delivery is a problem. Let's see it. If hesitancy is a problem, it's not. Of course, there could be a problem, but that's marginal. That's secondary issue. That's secondary issue. We need vaccines now to save lives. And let's not go around the bush now. We need vaccines, that's the problem. And I will tell you another story. I had a meeting with the allocation team. There is an advisory group we established that can help us to allocate vaccines that's coming through the COVAX. They're frustrated. They're disappointed because there is no vaccine to allocate. No vaccine. So there is no allocation if there is no vaccine. What do you share if there is nothing to share? That's the reality. So let's focus. And as media people, please, you know the truth. Just focus on what is failing. The world, as international community, other world is failing. As global community, we're failing. We're repeating the same mistake as HIV/AIDS, which took 10 years to reach the low-income countries after it was already rampant in high-income countries, and the H1N1 vaccines that was delivered to low-income countries after the pandemic, after the epidemic was over. Do we want to repeat the same thing? Can't we learn from what happened in the past? I think you know the answer. Please help us mobilize so the world comes back to its senses and help us open the world. The whole world is sick and tired of lockdowns. You can see it from how the citizens of the high-income countries are behaving now. They are so happy. It's opened up. Restaurants are full. The streets are full. Everywhere you go, you see crowds as if there is no pandemic. Then you go to countries where there is no vaccine access, still lockdowns. And the whole world is sick and tired, and the whole world wants to be opened up. And the tools are in our hands to open it up. So we need vaccines.